Penicillin, the new life-saving drug, was the motto during World War II. This miracle drug, as most would call it, was first discovered by Sir Alexander Fleming in 1929. In the process of looking at some mold samples he had been growing, he noticed that the bacteria closest to the mold had died due to the contamination of Penicillium fungi, and thought it appropriate to name the fungus penicillin. Later, after further study, he continued to find that the fungus killed harmful bacteria and found it to be non-toxic. In 1941, two scientists at Oxford University, Howard Florey and Ernst Chain, further tested penicillin and, using new science technology, made it into a powder that they could test on humans. After testing it on human subjects, they found that it miraculously cured seriously ill patients of their infection. During World War II, many people were suffering from bacterial infections due to soldiers' wounds and diseases such as diphtheria or measles, especially in poor and malnourished children. Before penicillin, the slightest scratch could lead to death. Penicillin has saved many lives, cured infectious diseases, and plays an important role in today's time. The development of penicillin throughout time has saved many lives. Before penicillin was discovered, only a select few diseases were curable with broad-spectrum drugs, explains Dr. David Winter, an MD specializing in pharmaceutical drug development. In an interview with a pharmacist at United Healthcare, Dr. Kyle Mellon said, "Millions of lives have been saved by penicillin because when a person is given that antibiotic, it is giving the body's immune system another weapon to fight off the bacteria." During World War II, the U.S. Office of Scientific Research and Development conducted large-scale clinical tests of penicillin on more than 10,000 patients. The results provided doctors with effective methods and dosages for the use of penicillin in the treatment of many diseases. Many people during World War II were in need of a treatment that would fight off their infections. During this time period, doctors gave penicillin mainly to soldiers who had an amputation and were fighting off infection, or people dying from more common diseases such as strep or pneumonia.
Thanks to penicillin and plasma, will come home to their thankful families. A whole world of peace to come will reap the benefits of this great wartime medicine.
The U.S. government, which early recognized the drug's value in treating wounded soldiers, prioritized production such that by 1943 there was a sufficient amount of penicillin to supply the armed forces. Dr. Winter said many people had been dying from blood infection, which, if not treated properly, could be fatal. The mass production of this antibiotic has saved many lives from once fatal bacterial infections. Antibiotics have seen a dramatic change in the figures for deaths and illnesses from infectious diseases. Penicillin has cured many infectious diseases throughout time. Dr. Mellon explains, this drug penetrates the bacteria's cell wall and breaks them down, causing the bacteria to die. Many of the most common diseases are pneumonia, meningitis, diphtheria, syphilis, strep, and measles. All infectious diseases are fatal, and before penicillin, anyone with an infection would end up dying, although some people did survive due to their immune systems being capable of fighting off the infection. Before penicillin, the only antimicrobial drugs available were quinine, arsenic, and sulfa drugs. Of these, only the sulfa drugs were useful for treatment of bacterial infection, but their high toxicity often limited their use. With this small arsenal, doctors were helpless to treat thousands of patients with bacterial infections. Penicillin was the first antibiotic to completely cure infections, says Dr. Winter. After penicillin was discovered, the chances of dying from infection decreased significantly. Although you can still die from infection if untreated, penicillin has made treating and preventing infectious diseases possible. Deaths by infections are 1/20th of what they were in the 1900s before anything had been discovered. Antibiotics have also provided safe and effective treatments for the wide range of infections that were a daily problem in hospitals and general practices. Penicillin plays an important role in the modern world. Dr. Kyle Mellon said, "When it first came out, we only had a few antibiotics. Today, we have over 100 antibiotics." Penicillin, explains Dr. Winter, was the basis of newer drugs and made it so that scientists could make them stronger and more effective. To this day, there are newer, more modified antibiotics that work on more than infections. Many variations of penicillin have been created, such as ampicillin, amoxicillin, and flucloxacillin. All of these are children refinements of the original parent, penicillin, says Frederico Winter, an 80-year-old who had been given penicillin multiple times. Penicillin inspired massive efforts to discover other new drugs that could conquer the many diseases still threatening the world, and since its fame during World War II, many pharmaceutical industries had begun creating new antibiotics. Further antibiotics soon followed, including streptomycin, chloramphenicol, tetracycline, and erythromycin. Hardly anyone can die from infections to this day because of penicillin. When penicillin first came out, many people tried to use it against viruses, which penicillin does not treat. Now, many infections are immune against penicillin, and because there are so many newer antibiotics, penicillin isn't as commonly used. Penicillin has been the base for many new antibiotics, which roles are very important in today's time. Not all of the newer antibiotics are derived from penicillin, but instead are based off the idea of penicillin. Many scientists in today's time are still modifying new antibiotics so that we are not immune against them. The discovery and development of penicillin has lessened the chance of people dying, has prevented death by infectious diseases, and has been the inspiration of new modified drugs. This life-changing drug has had a very strong impact on people and medicine. It has saved the lives of malnourished children and even the soldiers that fight for our country. Although hardly anyone dies from infection anymore, penicillin has been the basis for many newer, more common drugs to prevent infectious diseases. The event of Sir Alexander Fleming discovering that penicillium fungi kills harmful bacteria, and the idea by Florian Chain to further test Fleming's thoughts about the fungi, is how penicillin is a turning point in history. Not only could it stop infection, it saved lives from infections no one would even think you could die from in today's time. If that particular mold sample had been missed, maybe even today we wouldn't be able to fight off any infection.
It was a miracle drug. It cured so many diseases that had caused so much pain and suffering. Strep throat, rheumatic fever, scarlet fever, syphilis, and gonorrhea. It was things that we wouldn't even think about today should kill you.